If you've ever had a pair of shoes that gave you just a terrible blister on your heel, you usually don't pad the blister itself, right? You change the shoe.
Right, you alter the environment that's actually causing the friction.
Exactly. But when we look at how modern cosmetic medicine is dealing with anatomical discomfort, that logic is, oh, well, it's being completely flipped on its head.
It really is. It's wild to think about.
Yeah. Instead of taking away the thing that's rubbing and causing pain, practitioners are now building a specialized cushion entirely around it. So welcome to today's deep dive. We are looking at a highly specific question today, which is, can injectable filler actually help conceal a prominent or protruding labia minora?
And, I mean, it sounds incredibly counterintuitive at first.
Yeah.
For decades, the standard medical approach to excess tissue anywhere on the body was just, surgical subtraction.
Right, taking it away.
Exactly. If something protrudes, you cut it away. But the mechanics of using filler in this specific region rely on a totally different approach to physics and force distribution.
So before we get into, the syringe versus the scalpel,
Yeah.
we really need to map out the physical reality for you listening. We have to clearly define the anatomy we're talking about here.
Yeah, because the mechanics of this whole concealment strategy, it relies entirely on how two distinct structures interact with each other.
Right.
So we're focusing on two primary structures of the vulva. On the outside, you have the labia majora. These are the outer hair-bearing lips.
Okay, the outer layer.
Right. And biologically, they are primarily composed of adipose or fat tissue. They're literally designed to act as a protective, shock-absorbing outer layer.
Like a bumper.
Basically, yeah. And then sitting inside them, you have the labia minora, the inner lips, which are made of highly sensitive mucosal tissue. And that tissue lacks the tough protective layer that your outer skin has.
So the functional issue arises when those inner lips, the labia minora, are prominent, meaning they extend past that outer protective cushion of the labia majora.
Right, exactly.
And while there is, a massive anatomical spectrum of what is completely normal, having a protruding labia minora often results in some surprisingly painful daily realities.
Yeah, because that inner mucosal tissue is simply not designed to bear the brunt of constant environmental friction.
Oh, for sure.
When it protrudes, it gets subjected to chafing against tight clothing, the seams of yoga pants or swimsuits.
I can imagine activities like cycling or horseback riding become actively painful.
Oh, incredibly painful.
Yeah.
Because the tissue gets trapped, twisted, and micro-abrades against the saddle. It can also cause significant physical discomfort and pulling during sexual intercourse.
So historically, a patient went to a surgeon, and the surgeon physically cut away the protruding edges of that inner tissue.
Right, the traditional surgical route.
But this new concealment strategy we're looking at, it doesn't touch the inner lips at all. It focuses on plumping up the outer lips, the labia majora.
Exactly.
It makes me think of a photograph that is slightly too large for its frame.
Oh, that's a good way to put it.
Right. Instead of taking scissors and trimming the photo down to fit, you're just building a deeper, thicker frame around it so the picture sits recessed and protected inside.
The geometry of that analogy is spot on. By adding volume to the labia majora, you are increasing the vertical depth of that outer protective layer. You're creating a raised cushion that completely envelops the protruding labia minora.
But I keep coming back to the physical discomfort part. Does this thicker frame actually solve the chafing for you, or is it just a visual trick?
No, it actually solves the physical issue.
Wait, really? Because if the sensitive inner lip is still the exact same size, why doesn't it still hurt when you sit on a bicycle?
Because you have fundamentally altered the point of contact. It all comes down to force distribution. When the outer lips are plumped, they create a physical standoff distance.
Oh, I see.
Yeah. So when you sit on a bike saddle or put on tight jeans, all of that pressure is now absorbed by the newly inflated labia majora. That tissue is thicker, it's less sensitive, and it's designed for compression.
So it's literally taking the hit.
Exactly. Because the outer lips are projecting further out, there is a physical void created in the middle, and the delicate edges of the inner lips are tucked safely away in that gap. The friction is intercepted before it can ever reach the sensitive mucosal tissue. Wow, you're engineering a biological shock absorber. That clarifies the mechanics perfectly. So if we are engineering this cushion, we need to look at the building materials.
Right, what are we actually using here?
Yeah, because I see this procedure heavily referred to in the sources as a labial puff. What exactly is going into the tissue to create this volume? Well, for quick in-office procedures, the primary material is hyaluronic acid filler, or HA.
Oh, HA.
Yeah, these are specialized formulations. with brands like Deserial or Novia Intense Rose, designed specifically for vulvovaginal tissue resilience.
But wait, we hear about HA constantly in skincare and like facial lip fillers. It's naturally occurring in the body, right?
It is naturally occurring, yes. Hyaluronic acid is basically a very long chain of sugar molecules. Its most vital property is that it is incredibly hydrophilic, meaning it loves water.
Okay, so it pulls moisture in.
Exactly. It doesn't just sit in the tissue like some inert block of silicone. It acts like a biological sponge. It can actually draw in and hold up to 1,000 times its own weight in water.
1,000 times. Wow. So the volume isn't just coming from the gel itself, it's coming from the fluid that the gel is actively pulling into the area.
Yes, exactly. You get immediate volume from the gel, but then that's followed by sustained, intense hydration as it binds with local water molecules. And what is really interesting from a biochemical standpoint is how some of these specialized fillers protect that sponge.
Protect it how?
Well, for instance, Deserial includes an added ingredient called mannitol.
Mannitol. What does mannitol do in this context?
So think of the free radicals in your body as tiny molecular scissors. They are constantly moving around looking to snip apart the chains of the HA sponge, which is what breaks the filler down over time.
Oh, right, because your body naturally wants to dissolve it.
Exactly. So mannitol is an antioxidant. It acts as a sacrificial shield. It essentially throws itself in front of those scissors, taking the hit and neutralizing the free radicals so that the HA sponge can survive and retain its volume for a much longer period.
That is a brilliant piece of chemical engineering.
It really is cleverly designed.
But okay, since we are talking about putting gels into a highly sensitive, highly vascular area, we have to address the FDA warnings from our sources.
Right, the safety aspect.
Yeah, because looking through the clinical alerts, the FDA sounds genuinely alarmed about unapproved fillers and devices being used for body contouring. Is it actually safe to be injecting these materials below the belt?
It's a great question. The distinction here is really between targeted medical application and unregulated large-scale body modification. The FDA has issued stern warnings against using things like injectable silicone for large-scale contouring, like buttock enhancements.
Right, the dangerous basement procedures you read about?
Exactly. They also explicitly warn against using needle-free high-pressure pen devices.
Oh, I've seen those on social media because a high-pressure device is just blindly forcing material through the skin barrier.
With immense force and zero control over where the product ends up. If that high-pressure blast forces gel into a blood vessel, it causes a vascular occlusion, it blocks the blood supply, and the surrounding tissue literally dies and turns necrotic.
Oh, wow. That sounds horrific.
It is. However, using approved hyaluronic acid fillers in the genital area is a completely different medical protocol. A licensed medical professional uses a blunt-tipped cannula.
A cannula, not a needle.
Right. Unlike a sharp needle, a blunt cannula slides through the tissue planes and actually pushes blood vessels out of the way rather than piercing them. In regions like the UK and Europe, these specific HA products are strictly approved for vulvovaginal use.
And what about in the U.S.?
In the U.S., a physician might use an FDA-approved HA filler off-label, relying on their specialized anatomical training to navigate the vascular network safely.
So it sounds like the safety profile is entirely dependent on the physician's intimate knowledge of where the arteries are. You really don't want someone guessing with a syringe.
No, absolutely not. You want a specialist who understands pelvic floor anatomy, not just a casual med spa injector who usually just does lip flips.
Right. So HA acts like a water magnet, but it is temporary. If someone wants to build that cushion permanently without relying on foreign gels, what is the alternative?
Well, the alternative building material is the patient's own adipose tissue, known as an autologous fat transfer. This requires a minor liposuction procedure, usually harvesting fat from the lower abdomen or the inner thighs.
Okay, so you extract the fat, purify it, and then inject it into the labia majora. But I imagine it's not quite as simple as just moving fat from point A to point B, is it?
No, the critical biological hurdle with a fat transfer is that the injected fat cells have to survive the move. They are living cells.
Right, they need a blood supply.
Exactly. When you inject them into the labia majora, they must successfully reestablish a blood supply in their new home. If they don't hook up to the local blood vessels, those fat cells will just die off and get reabsorbed by the body.
Does all the fat usually survive?
Usually, only about 50 to 70% of the transferred fat survives long-term, which is why surgeons often slightly overfill the area initially.
That makes sense. And that brings us to a major crossroads for anyone considering this. If you are sitting in a clinic dealing with severe chafing, You are essentially choosing between the syringe and the scalpel.
The temporary cushion versus the permanent reduction.
Exactly. Let's compare this injectable camouflage, the labial puff, to the traditional permanent fix, which is surgical labiaplasty. Let's look at the actual mechanics of the surgery to understand why someone might try so hard to avoid it.
Right, so surgical labiaplasty involves permanently altering the anatomy by cutting away the excess labia minora tissue. The two dominant surgical techniques are the trim method and the wedge method, and they heal in very different ways.
Let's start with the trim method.
The trim method, or edge excision, is the simpler of the two. The surgeon uses a scalpel or a laser to simply cut away the darker outer edge of the inner lip, completely removing the overhanging tissue.
But the body's wound healing response to that is where the complications arise, right? Because when you cut the entire outer edge off, it has to heal with a continuous linear scar spanning the entire length of the labia.
Yes, and scar tissue is functionally different from the native mucosal tissue. Scar tissue is primarily dense collagen. It completely lacks elasticity.
Oh, that sounds problematic in that area.
Very. When you have a linear scar running the full length of a highly mobile area, that scar can shrink and tighten over time. This is called scar contracture. It can cause a chronic pulling sensation, tightness, and significant pain during intimacy. You also lose the natural textured anatomy of the labial edge.
So wait, the alternative to that, the wedge method, that tries to solve the edge problem. Instead of cutting the whole border off, you're taking a V-shaped pie slice out of the thickest middle section of the lip and then pulling the two remaining sides together to collapse the gap.
That is the exact geometry, yeah. The advantage is that you preserve the natural outer edge and color of the labia, and the scar is hidden vertically. But the biological trade-off is tension.
Tension.
Yeah, when you stitch that V-shaped closed, all the tension of the moving tissue is centralized at that surgical junction. If it heals poorly, the wound can separate a complication known as dehiscence, or it can form a painful, hardened knot of scar tissue right at the apex of the wedge.
Ouch. Plus, there's the risk of over-reduction with either method. If a surgeon takes away too much tissue, you lose the natural funneling mechanism that directs moisture, leading to chronic dryness, and you lose the protective barrier for the vaginal opening itself.
Not to mention the sheer physical trauma of the recovery.
Yeah.
With surgery, you are looking at weeks of swelling, bleeding, managing dissolving stitches, and a strict ban on physical activity to ensure the wounds don't tear open.
So compare that physical toll to the filler alternative. The filler procedure takes about 15 to 30 minutes under local anesthetic.
Yeah, much faster.
No scalpels, no linear scars, no stitches. It's essentially the difference between taking a tailored suit to a seamstress to have the fabric permanently cut and resewn versus just wearing really effective shapewear.
I like that. The shapewear analogy works well here.
Right. The shapewear gives you the silhouette and the friction relief instantly without permanently altering the garment. But the reality of shapewear is that you eventually have to take it off. What is the long-term reality of the labial puff?
Well, the clinical reality is that choosing filler is an agreement to lifelong maintenance. It is absolutely not a one-time fix. We have to look at how the body processes these materials over time.
Because hyaluronic acid doesn't stay in the tissue forever.
No, it doesn't. Your body naturally produces an enzyme called hyaluronidase. Its entire biological purpose is to seek out and cleave the bonds of hyaluronic acid chains, breaking them down into smaller molecules that the body then flushes away.
So it's actively trying to get rid of the filler.
Exactly. Depending on an individual's metabolic rate and the specific cross-linking of the filler used, that enzyme will completely dissolve an HA labial puff in roughly 6 to 18 months.
Let's talk about the reality of the wallet here, because if you are considering this, the math gets daunting fast. In the UK, HA fillers cost around 250 to 400 pounds per milliliter.
It adds up quickly.
And because you are trying to build a substantial structural cushion, practitioners note that a minimum of 2 milliliters and often much more is required.
Yeah, you are looking at spending upwards of $800 to over $1,000, and then you have to repeat that entire expenditure every single year just to maintain the physical buffer zone.
So if you are dealing with severe protrusion and constant daily pain, doesn't traditional surgery actually make more sense mathematically? I mean, it might be a higher upfront cost, but once the tissue is gone, the problem is solved permanently. You aren't tethered to an annual subscription for labial filler.
From a purely financial standpoint, over a 10-year horizon, surgery is almost always more cost-effective. But the choice often comes down to risk aversion.
How do you mean?
For someone terrified of permanent nerve damage, irreversible scar contracture, or the absolute finality of having tissue amputated, the ongoing cost of filler is a premium they gladly pay for reversibility.
Oh, reversibility is huge.
Yes. If you have an HA filler and you hate the physical sensation, or if it doesn't solve your chafing, a doctor can inject concentrated hyaluronidase to dissolve the gel almost instantly. You cannot uncut tissue.
Reversibility is a massive psychological safety net. I completely agree. But we also have to look closely at the complications of the filler route because building this cushion carries its own unique pathologies.
It does. While generally safe, any injection carries risks of bruising or localized swelling. But the specific complication we need to examine involves how the immune system interacts with the filler. A board-certified surgeon in the medical literature, Dr. Karen Leong, explicitly states that she refuses to use hyaluronic acid fillers for the labia majora due to documented issues with granuloma formation.
Granulomas. How does a granuloma actually form in this context?
It is a fascinating, albeit frustrating, immune response. When the HA gel is injected, your body's white blood cells, specifically macrophages, detect it as a foreign substance.
Right, their job is to engulf and destroy invaders.
Exactly. But the bolus of gel is simply too large for a microscopic cell to eat. Frustrated, the macrophages send out inflammatory distress signals. The immune system decides that if it can't destroy the gel, it will quarantine it.
Oh, wow, it walls it off.
Yep. It begins laying down a dense, fibrous wall of scar tissue completely surrounding the pocket of filler, walling it off from the rest of the body.
And that fibrous wall turns into a hard, painful nodule sitting under the skin. And because the genital area is subject to constant movement, pressure, and friction, it creates the perfect, highly agitated environment to trigger that exact immune response.
Precisely. To avoid that, Dr. Leong prefers using the patient's own fat or utilizing biostimulatory fillers like polylactic acid.
How do biostimulatory fillers bypass the granuloma issue?
Well, instead of injecting a giant blob of gel to act as a physical spacer, biostimulatory fillers are injected as a suspension of microparticles. These particles intentionally cause a controlled, microscopic inflammatory response in the tissue.
So it's irritating the tissue on purpose.
Right. This localized irritation wakes up your body's fibroblasts, the cells responsible for producing structural proteins. It forces those fibroblasts into overdrive, making them lay down vast amounts of new endogenous type 1 collagen.
Wow.
Over a few months, the actual injected product fades away completely, and what is left behind is a thickened, plumper cushion made entirely of the patient's own newly synthesized collagen.
That is incredible. You are essentially tricking the body into growing its own protective frame.
It's amazing technology.
But even with these advanced materials, this procedure is not for everyone. There are strict contraindications mentioned in the sources.
Yes, definitely. Pregnant or breastfeeding women are automatically excluded, as are patients with active localized infections or a history of severe autoimmune diseases like scleroderma, which affects connective tissue.
Right.
But a critical warning centers around underlying dermatological conditions, specifically lichen sclerosis.
What happens to the tissue with lichen sclerosis?
It is a chronic inflammatory condition that causes the skin of the vulva to become extremely thin, pale, and structurally fragile. It causes intense itching and painful tearing.
Oh, that sounds awful.
It is. If a patient comes in complaining of vulvar discomfort and an untrained cosmetic injector just pumps the area full of filler without diagnosing the underlying disease, they are making a dangerous mistake.
Because it's stretching the skin.
Exactly. Injecting volume under lichen sclerosis tissue stretches an already fragile, diseased skin barrier, exacerbating the tearing. More importantly, untreated lichen sclerosis carries a risk of developing into squamous cell carcinoma, a type of skin cancer,
So masking the symptoms with filler delays critical medical treatment.
which could be life-threatening.
It perfectly illustrates why anatomical modifications, even cosmetic ones, require deep diagnostic expertise. Okay, so if we step back and look at the core question, yes, injectable filler absolutely can conceal a protruding labia minora. It achieves this mechanically by increasing the vertical depth of the labia majora, creating a biological shock absorber that intercepts friction before it reaches the sensitive inner tissue.
Right. It provides a fast, non-surgical alternative for patients seeking relief from chafing, allowing them to bypass the scalpel, avoid the risks of painful scar contracture, and maintain their natural anatomy.
But it requires an ongoing commitment to maintenance, recurring financial costs, and an awareness of immune responses like granulomas.
It's a trade-off like everything else in medicine.
It really is a pragmatic shift in how we manage physical realities. We usually assume the only way to solve an anatomical annoyance is to trim it away. But this movement toward the syringe suggests a deep philosophical pivot prioritizing camouflage over alteration. We are finding incredibly sophisticated ways to build biological buffers around the parts of ourselves that cause discomfort.
It's a totally new era of body modification.
It begs the question, as regenerative medicine and injectables become even more advanced, will we eventually abandon the idea of permanently altering our baseline anatomy, preferring instead to endlessly construct, dissolve, and rebuild these temporary cushions to navigate the world without friction? Something to think about next time you feel a blister forming.